Physical Therapy Assistant, presented by Jose Rodriguez Jr., College 100, 1038, Summer 17. Greeting, Professor and fellow classmate. I chose Physical Therapy Assistant as my career topic to discuss for my final project presentation. This career is perfect for someone like myself looking for something different and enjoyable after completing my military career. Physical Therapy Assistant is a challenging and rewarding career that requires both self-motivation and the passion to help others. Education requirements. First, we will look at some education requirements in becoming a physical therapy assistant. We will look at these three areas: associate's degree program, clinical, and the National Physical Therapy Exam. Someone who is looking to become a physical therapy assistant, at a minimum, will require to complete an accredited associate degree program. Some courses besides your basic English, history, science, mathematics courses are as follows: therapeutic exercise, medical terminology, healthcare law, human development and rehabilitation procedures, and a few others. Clinical education hours makes up 25% of the physical therapy assistant program. Here, the PTAs will learn more hands-on techniques and shadow a physical therapist as they diagnose and treat patients recovering from an illness and or injury. PTAs will work several hours in a clinic and will also be taught step-by-step procedures to help guide the patient to their ultimate goal, a full recovery. Let's look at some PTA students doing some hands-on. Enjoy.
All right, now we have a patient who is a paraplegic patient. Let's say paralyzed. That was good for a paraplegic patient. Paralyzed from the waist down at some point, okay? What gait pattern do you think that person's going to use? A bilateral swing too, okay? So both crutches forward and then both feet. Turn the space, lady. Go a little bit faster. Okay, your patient is having a hard time. After the feet come forward, the patient's losing his balance. What are you going to do? Add a pause. So you're going to bring crutches forward, feet, and then crutches again real quick. Crutches, feet, crutches, crutches, feet, crutches. Good. Good job.
The National Physical Therapy Exam is your next step to officially receive your PTA license. The National Physical Therapy Exam is given by the Federation of State Board of Physical Therapy. This exam has 250 multiple choice questions. It is scored by a 200 to 800 point range, which 600 points is the minimum to pass. This exam costs roughly $400 and is required to be paid in advance. Duties and responsibility. According to the 2014 and 2015 Occupational Outlook Handbook, physical therapist assistant typically do the following: observe patient before, during, and after therapy, noting their status and reporting to the physical therapist, help patient with specific exercise as part of the plan of care, Use a variety of techniques such as massage, stretching to treat the patient. Use devices and equipment such as walkers to help the patient. Educate the patient and family about what to do after treatment. Here's a short video that will briefly explain a little more on what a physical therapy assistant do. Enjoy. Salary and benefits. A physical therapy assistant make around $24,000 to $74,000 annually. This all depends on the state which the physical therapy assistant is trying to practice. This is a growing profession that does not require an intensive 4 to 8 years of schooling and pays well. Here are some more benefits of becoming a physical therapy assistant. Location. PTAs are needed in every state in the United States. Helping others. PTAs are there every step of the way to help the patient recover. Patient rely heavily on the PTA's help. Growth. PTAs can eventually further their education and become physical therapists. Important member. PTAs are important members that works directly with both the physical therapist and the patient. As Ms. Mary LaMartina, a staff nurse from the Kenmore Mercy Hospital stated, we have achieved a complete continuity of therapy. We have engaged in early intervention of each patient and family. And there's have been a dramatic increase in mobilization and overall fewer complications. Patients and families enjoy being better patient advocates, taking control to the higher level of wellness. This was all accomplished through the cooperative team approach, introducing a vital new member, our PTAs. Here are my references I use when putting together my presentation. Scholarly sources from the AMU library. Web sources, video sources. Image sources. This concludes my presentation on physical therapy assistant. Hope you enjoyed, and I wish everyone the best as you further your education.